Welcome to Psych Incubator and Eminent Psychotherapists Revealed. I am very pleased, we are pleased to have as our guest this evening and this afternoon, depending on where you are, Dr. Anastasia Kim, who is a tenured professor at the Wright Institute in Berkeley, California. She received her BA in psychology from University of California, Berkeley, and her PhD in clinical psychology with a minor in developmental psychology from UCLA. She is a National Ronald McNair Scholar and the recipient of several awards, including the American Psychological Association Minority Fellowship, ACORA, Mental Health Fellowship, and APAGS Guardian of Psychology Award. She has, in addition to teaching in graduate school, she has a private practice where she specializes in treating children, teens, and young adults with anxiety disorders, depression, and also neurodiversity. She has written a number of books, and she presents widely on diversity, equity, and inclusion. There's a lot more I could say about her, but so we can get right into it, I'll let you guys all read about it when you have a chance, read about her when you have a chance. So thank you for joining us, and thank you all for joining us as participants. Welcome.
And I'll just add something before we get started. At the end of an hour, the recording will be stopped, but we'll hang around as long as there are participants who are interested and just to continue a conversation. And secondly, regrettably, on this webinar, you don't get to raise your hands or be seen, but there's a Q&A place, and I will actively monitor that. So feel free to break in and make yourself a part of this conversation. Okay, so I'll start with a question. Could you describe, well, how do you describe your particular niche or specialization? And could you tell a little bit about the path there?
Missed the end of that. How she got there?
Yeah, I think she froze. So
yeah, but I think okay.
So if I understood, it's a little disjointed because I think connection issues. First and foremost, thank you so much for the invitation. How lovely and what a privilege it is to be in conversation for the next hour with you. So thank you for that. I don't know, I have a number of niche areas, if you will. As Jeffrey mentioned, in addition to teaching, I've been at the Wright now 19 years. So
wow.
teaching doctoral students full time. I also have a small private practice. So my specialization really is with young folks and in anxiety. My background is more cognitive behavioral therapy, and I'm a huge proponent of relational therapy, attachment, given my developmental psych minor background, and a lot of family systems and social justice, like liberation psychology, also those principles inform my clinical work and also my teaching. And then when I'm not in the classroom or in the consulting room, I do a lot of diversity, equity, and inclusion outside of the field of psychology as well as inside. And a lot of that is absolutely informed by my expertise and training and the work that I do. I think it's such a fantastic and phenomenal time to be a psychologist. It has always been, but much more so than ever before. Mm-hmm. And so I really like to work with organizations that are not traditionally education or psychology, because our strengths and our expertise are really needed in so many sectors across our society and community. So I have developed a model really for my own professional and personal use that over time I have developed, and offered trainings in, and is the topic and basis of my first book a few years ago. And that's an.
And what's the title of your first book, just so that our viewers?
It's Time to Talk and Listen: How to Have Constructive Conversations About Race, Gender, etc., in a polarized world. And it really is for a lay audience. We worked with a
Good.
publisher, and they really wanted the pitch to be with a lay audience. And it's a step-by-step approach. It's an 8-step approach, and it is informed by more skills-based and also relational attachment sort of component. And so as psychologists, you could probably dissect the model and see where some of the psychological theories and principles are embedded in this. So I do a lot of that work. And one of the current books that I'm working on now is for for educators in higher ed in general, not just within psychology, but across the board. More and more, I think there is a need and a demand and a wish to support difficult conversations, regardless of what it is you are teaching at the level of college and beyond. And so it's definitely the case that many of us, myself included, would love additional resources so that we know what to do with inevitable barriers and challenges and missteps that we're all vulnerable to. So we're putting together with Rutledge, Taylor, and Francis an educator's guide to kind of support that. That's also very much skills-based. Yeah. I hope that answers your question, Barbara. Yeah.
Yes, it does. It does. And I mean, for the number of years you've been teaching, you must just have had so many challenging conversations of your own. So have you had one recently? Do you want to give us an example of a conversation you had and, kind of elaborate on the 12-step model?
Yeah. I mean, there are opportunities for so many difficult conversations. I think in general, the most difficult conversations that relate to things of this nature, really for me, and maybe for maybe for others, is really with my family. Yes, it is with patients. Yes, it's with students. And yes, it's at faculty meetings. Good Lord, faculty meetings, right?
Yes, yes, yes.
But, it's with the people with whom we have the highest investment and also the longest baggage or the biggest baggage, both at the sort of the same time, where stakes are really high. So I think that those for me have been the most memorable, most difficult, challenging, and also rewarding. Just this morning, I was teaching with students, and we were practicing this particular model as students wanted to seek some consultation about navigating kind of a thorny dynamic issue with a colleague at work, in field placement. And so we were trying on, like, what would it look like from this particular approach? Let's not just talk about it. Let's begin to maybe, do a little role play and put some vocabulary and words to some of our emotions and our intentions and our goals. But the 8-step approach really starts in a number of different phases. The first phase really is a preparation phase, and that accounts for the first 3 steps. If we know something is going to be difficult, and we can appreciate this as psychologists, as mental health folks, we want to be able to pause. Maybe that pause is a quick 3-second breath, or maybe that pause is, let me get back to you, Barbara, next week, after I've given some thought and I've kind of been able to monitor a little bit of my knee-jerk strong emotions. So first phase is a preparation phase. It's an intrapersonal, intra sort of psychic process that involves some clear articulation of, why is it that I want to have this conversation with Barbara, my colleague? What am I trying to achieve here? And number 2, what are some barriers that I might be able to anticipate? Yeah. And once I've calmed down a little bit, I might be able to identify some predictable, likely barriers. Yeah. And then number 3, in the midst of these barriers, and they often tend to be quite abundant, including, I want to tell Barbara that she was wrong, at the same time, I guess I don't want her to feel bad, and we have to work together, and she's a colleague, and we're on this sort of committee together, whatever, or we're co-facilitating a group sort of together. And so there are a lot of barriers that could get in the way And I want to have some clear articulation. At the same time, I still want to be brave and lean into having this difficult conversation. So step 3 really is a values-oriented tethering and grounding. How do I conjure up enough gumption and courage in spite of all these likely barriers that could happen, and still lean in and believe that Barbara and I could do hard things together, including having this particular conversation. Yeah. So that's step number 1, 2, and 3 that accounts for the preparation. And then step 4 is really the invitation. The next phase is really the invitation. The title of the book is It's Time to Talk. And in parentheses, it says, and listen. Maybe I should have had listen like underlined, bolded in all caps. That's the hard part, isn't it? But it really is the invitation. So steps 4, steps 5, and 6, it's the invitation and also the conversation that happens. How do I invite somebody knowing that this is going to be a difficult conversation? How do I deliver my sensitive, delicate cargo that is my truth, that I do want to share and articulate, but I also want to make sure that it is as optimally received because I deserve it and because maybe the relationship between you and I, deserves an opportunity for communication with this delicate cargo. And then some breakdown in terms of how to do some deliberate, thoughtful listening. Yeah, it's not just I'm going to offer, but how do we make sure we share something that's delicate, but also this is, I wanted to share my experience because this is, we are colleagues and we'll continue to be colleagues. We might not see eye to eye on sort of everything. And I want to make sure that I also understood what you said at the faculty meeting or in that group that we were running, because what I thought I heard you say, landed on me in some kind of way. And out of respect to our relationship, I wanted to share that with you. Yeah. And I wanted to check in with you, Barbara. Did I hear you correctly? Did the way that I interpret what you said, I wanted to give an opportunity to better understand where you're coming from. So that's really the listening part, and then the final stage really is repeat, reflect, rinse, and, recycle and repeat again. I would love to say that I have come up with this one and done uniform conversation that is foolproof, that is transportable in all contexts. And that's just not the case. Part of what we're dealing with are centuries old injuries that have preceded all of us in our present lives, such as systemic racism and sexism and classism and heterosexism, all kinds of sort of isms, if you will, ableism. And we are daring in some ways, to both lean into injuries and traumas yet unresolved and still unfolding, with some audacity to begin to talk about it and broach it. So it is reasonable to assume that one conversation, even between myself and my co-facilitator or my colleague Barbara or my patient Barbara, whoever, is not going. So, step 8 really is, can we give ourselves an opportunity to pause, to kind of rewind, review what happened, give myself a time to sort of calm down, be proud of maybe some of the things that I did, including leaning in or listening when I really didn't want to. And then can I reflect on my areas for growth? Because we all have them. We all do, and we hopefully will for the rest of our lives. And, out of respect to myself as a professional and a person, and thinking about areas where I could do better next time.
Yeah.
I think about a gentle interrogation of myself. Yeah.
And this
Go ahead.
is just so timely in so many ways, because we all are experiencing this extreme polarization in our country and in the world, and as a practitioner, I'm hearing stories about families, and in my own family, hearing how people are splitting off because they're so divided and polarized, and sometimes it seems like these are not conflicts that disagreements that we can breach, that we almost have to have people out of our lives. So I've never experienced anything quite like this in my time, like this extreme polarization. I mean, I remember arguing with people about the Vietnam War and stuff like that, but there's nothing I've ever experienced like I am living now. I don't know how the rest of you feel, but it's
Well, I think you're right, because the amount of hate that's been unleashed and made acceptable kind of makes the discussions difficult, because it's acceptable to behave in a particularly abrasive, attacking way. But what Kim has told us about is very insightful, very moving, feeling these different aspects of how you deal with people when you disagree with them, and yet you care about them. It made me think that I wanted to get more of it, and so I thought that the idea she had said about a role play might be really great, because I think we could see how it plays, and it will be enriched if we can feel what's going on and taste it, make it organic.
Well, I'll be glad to volunteer to be the person who commits the microaggression.
Yeah.
Actually, it's nice. It gives me permission to be terrible. So I like that.
Can't believe it. Can't believe it.
So do
yeah,
you want to give us?
you're not really terrible enough, Barb. So let's
We'll
That's
see.
why I like
If
this.
So
she
you-
doesn't,
so
if she
let's-
does not
let's your-
terrible enough, we'll kick it up a little.
let's let your
Right.
your mean girl self go now. All right.
Yeah.
Good.
Anastasia, do you want to give me a little bit of a script, or, we've talked about a couple of examples?
I mean, honestly, if there are, for any of you, sort of three, a particular thorny situation that you are navigating, either in your professional or personal sort of life. And I include the personal in part because I hope that there is some utility and transportability of this approach, regardless. So this is not a therapy or consultation room specific orientation. I'm not here teaching about the tenets of CBT and principles. It's not that at all.
Yes.
So if there is a particular, because in some ways that would make it a little bit more rich and nuanced, because it's something you are actually experiencing. So maybe I'd love to turn it over to you and see if there is it doesn't have to be the most thorny, because I think we are in the company of audience and it's being recorded, and we could do that afterwards. I'm certainly happy to. But if there is a particular thing that you are navigating, or a common theme or a common type of dynamic that you have encountered in your professional capacity, or even a personal one, in which you're like, this is always so uncomfortable, and this is always so aversive in some way. And I feel like this is an area, could be one of my areas for growth. Maybe it's you, Barbara, Jeffrey.
I'll take a crack at it.
Yeah.
Okay.
Thank you, Mike.
So Doc, tell me, how are you going to help me?
Oh, so you're going to play the part of the patient?
I'll be the patient. Yeah. Well, how can I play your part? You're teaching us.
Yeah.
But Michael, that's sort of so general. Could you start?
I could be. Look. This is a rotten world with a lot of rotten people, greedy people who take advantage, people, robber barons, and then people trying to steal food off some other poor working slob's plate. Why should I? I have nothing to look forward to. And women, you get involved with them and they just grab what they can and run off.
Yeah. Well, Michael, yeah, it sounds like that sounds very painful, and a lot of you've shared a lot. Thank you for sharing that. I'd love to hear a little bit more about what you said, or any part of that that's been maybe most painful, or that's coming up to surface right now for you at this particular moment.
Yeah, I just work very hard to make people kind of feel that I'm there to do things for them, and I'm constantly being let down. People will, I think I must wear a sign that says Mark. I'm easily moved to buying somebody's sob story. And then about the fourth time through it, I realized that this is not ever going to help them. They're going to have 1,000 sob stories. They're not interested in using anything that I teach them.
Yeah.
Then they won't repay the debt that I loaned them,
Yeah. Michael, I'd love to maybe go back to a statement that you said a few minutes ago about women in particular. And let me just put in the parentheses, instead of making this a general therapy, I want to sort of zero in on a particular identity within this particular approach. I wanted to kind of, wanted to go back and better understand what you meant when you said that women in particular. I wanted to better understand what you're meaning.
Oh, look, they want money, they want babies, and they want to do what they want to do.
Yeah.
Not what I want to do. They want to do what they want to do.
Yeah. Well, could I, for the purposes of sort of
Yes, please.
interest sort of time,
Yes.
I'm wondering if you could, Michael, I would hate to give you a directive as a therapist, but so that we could really kind of punctuate sort of the illustration sort of for this, did you want to, maybe I could accelerate it. Did you want to sort of, commit, if you will, a microaggression or sort of say something sort of sexist? Is that where you want?
Well, look, I go to the pub and I'm sitting with some friends. And we have a beer and sitting and talking. And there's a young lady there who's kind of watching us. And then after a while, she comes over and says, "Do you mind if, I join you?" And she says, sure, have a seat. And she talks a little bit. And then pretty soon she's asking me a ton of questions. And she wants to know more and more about what I do and why I do it. And I'm thinking, I just met you. I mean, he's up here, I said, she's going to want my phone number. She's going to want to, she's going to bug me forever. So I say, I too much.
And was your comment earlier something about sort of women in particular? Was there something about any aspect of her gender here that that feels important to?
Well, it could be men doing it too, but it seems like, it's easier to unentangle, and the pain of it isn't as great.
Yeah. So it sounds like you're thinking about a lot of things and also wondering if maybe, her gender and her being women and maybe your experiences with women might play a role in some of what you have experienced. Let me just sort of stop this for a sec, because in this, how it's unfolding here, I don't know that I would actually employ.
Yeah. It's not really there's not real, Michael, you're not really offering like even a microaggression to pick up on.
I'm trying to restrain myself.
Well, yeah, but I think it's coming across more like a therapy session as opposed to an example of someone saying, yeah, those
Look,
women those goddamn women are all they're all just bitches,
They're just worried about what they need, and they are just, they just want us to provide all kinds of things for them, special times. They don't have to work, they can stay home and take care of babies, but they just, they don't want to lift their fingers up and do what's really required.
Yeah, Michael, I mean, thanks for sharing that. It definitely sounds like you've had many experiences where this has been super sort of painful for you. And it also seems like there are some sort of general ideas you hold. This is something that I remember you mentioning.
You are so carrying out with these minimizing things and intellectualizing. Come on, come on,
Yeah.
give it a break.
Okay, hold on one second. I want to sort of pause for a sec and then go back to something really important. These comments about women that you have made, just a few minutes ago, no doubt it's been such a place of painful experiences for you for a long time. It's also a comment that you've made for the last 4 sessions that we have sort of been meeting. And I've been really sort of thinking about whether to sort of broach this particular sort of topic with you, given the actual firsthand experiences of pain and challenges that you've had. But I wanted to take a risk with you, Michael, because we have been doing such hard work together, and you have. And so I wanted to broach a conversation regarding maybe your conceptualization and thinking about women in particular. And, the comment you made earlier about those goddamn women, and I'm curious where that come from and what it's like to sort of work with me as somebody who is female identified. And I have to admit, the repetitive
Identified?
goddamn women have landed in some kind of a way. And I want to make sure that I do my sort of due diligence in being able to be sort of thoughtful. So I wanted to sort of sensitively, broach this sort of topic and hope that we can maybe talk about it. Yeah.
Okay. Look, this is, you want to talk. Okay. So, I'm not expecting much. I don't expect anything good to happen.
Yeah.
It just has not been my experience.
Yeah. I'm curious about whether me also identifying as a female person, as a cis sort of female, how you're experiencing that and the very painful experiences that you seem to have had with the women in your life and the reference and,
Well, look, what's your angle? What is it you want?
Yeah. Well, I really am hoping that we can actually have some maybe brave conversations here between you and Di about a particular, aspect. And in this case, about sort of gender. And I am curious, given the very painful experiences that you have had with women and the fact that you're working with me, also a female identified sort of person. And if I'm being perfectly honest and, out of respect to our sort of relationship, I wonder, I've been curious about whether I am also fall into one of those goddamn women that you have referenced a number of times before. And I'm hoping, it's a little bit of a thorny issue, and we certainly don't have.
Of course you fit in, I mean, look, when I was 12, my mother left and I never saw her again. And, well, why would I trust you?
Yeah. Well, I appreciate your insight and your ability to share that with me. And, what you shared it feels pretty big. Yeah, I didn't realize that. Yeah. How painful.
I wonder if we could stop here and use this as a point of exploration, because we could get deep here.
Yeah.
But I guess where I am right now watching this dialogue between you is, so one of the questions I have, Kim, is when this relates to early relational trauma, like when the person's their encoded beliefs about women is related to being traumatized in some kind of, in what Michael's saying is abandonment trauma, right? He's had relational trauma, and there's likely unprocessed anger toward women in general, generalized. How much, so when we're in the therapeutic zone, how much overlap is there between like what you're trying to communicate to Michael about his belief
She,
system.
she just did. She just was compassionate. She began, I handed her
Yeah, no, I saw that, but I was
opportunity.
wondering, without going further into the role play, because I think we could stop and talk about it now, where would
Yes.
you see that going at this point, I guess, is what I'm curious about.
And I think that that is the professional task here. And I don't know that it is a finite and a definitive algorithm that we have, conceptualized and sort of spit out. I mean, part of our job as therapists is the moment-to-moment attunement, right? And I mean, I was making some of this up along with sort of with Michael, and I just wanted to suppose that I didn't know this piece of information. And in that moment, I had the intention really of like, my God, this guy's coming in, I'm going to make something up, some work-related sort of stress. And then
Yeah.
he's like saying all kinds of misogynistic sort of comments.
Yeah.
I'm going to have to bring this up,
Yeah.
And, that's why I sort of said, after a couple of times, is this sort of his demeanor? Is this, so I've been sort of thinking about it, sitting with it, part of that preparation sort of like phase. What would be my goal? What is it? How is it sort of aligned? How isn't sort of aligned? And I come to a determination like, you know what, this is part of the language, and it's making it very difficult for me as a woman, even if I wasn't a woman, any misogynistic sort of like comments, it would be very difficult for me to stay as focused as Michael deserves me to do, because that is my work, regardless of our therapeutic orientation, right? To be able to be fully compassionate, empathic, attuned. But all these horrible sort of comments about women is really, because I'm a human person sort of first and foremost, is really competing and compromising my ability sort of to do that. And in spite of some of my previous sort of attempts, it is something that I must sort of address. And I think about that as an ethical responsibility on my end. But then Michael sort of says, you know what, Dr. Kim, it has, I didn't tell you, but my mother left me. And that's where it sort of started. And then that's when I, through my attunement, is like, I'm like, all right, this conversation about gender and misogynistic comments, I table for this moment.
Okay.
Now he's been able to sort of touch on a particular sort of pain point. I table it, not necessarily to go away. So I give the room that my patient Michael needs and deserves. To talk about an unresolved sort of trauma that is still reverberating in his present adult sort of life. And then when I feel, again, my clinical judgment, when it's appropriate, maybe 5, number of sessions down the road,
You circle back.
Michael's still sort of saying, God, that goddamn effing women and that be this and this and that. And I'm like, okay, Michael, and I would then connect. I definitely sort of see where some of this, but I have to say, it's really difficult for me to be able to really pay attention to you in the ways that you need and all the ways that you sort of deserve when, every other word is, be this and, goddamn women sort of like this and that. And I wanted to take a risk to be honest with you about it, because you deserve, and I trust in the work and you have done so much hard work. And, I believe in our ability to maybe even broach some difficult things, even between you and I, So, it's not just the what, it is absolutely not only the why, but when and how, and then the dance that is a dynamic dance, flow between centering the client and then coming back with some of these microaggressions or comments that sort of is made. And then hopefully with some sort of time and continued collaboration and alliance, we're able to do a little bit of both,
Well, let's skip forward then to that point where you've done that.
Yeah, just want to make sure, Jeffrey, did that answer your?
Yes, it does. Yeah. Very, very nicely.
Okay, so we will pick it up. We'll skip forward 5 sessions.
Yeah.
And okay, and so you're kind of telling him how hard this makes it. Me hard, and now, how you're going to work with that. I'm going to continue to be him. No big surprises, but he's going to be very careful, and he's not very trusting, and which is the case with many people you treat. So this is it's maybe a nastier than usual, but that was what we were looking for. Somebody with a little color.
Actually, not as nasty as we often. I mean, the case that I was talking about before we got on.
He was much nastier.
Oh my gosh, yeah.
I know.
yeah.
So I toned it down. So,
Yes.
okay.
So then let's say Michael does get very nasty, and I began to realize in my work with Michael that some of this, or a lot of this, is really the kind of socialism, maybe it's a combination of socialism and also sort of trauma, particularly with such a seminal figure early in his sort of like life, but he keeps on sort of saying this, not even when talking about maybe his female coworkers, and not related to the trauma.
Oh, getting worse and worse. He
It's
brings
getting worse and
he's
worse.
going to bring in racial issues. He's going to
That's
bring
right.
in
And maybe because
lazy
you become more
farmers.
comfortable with me, you're just kind of free flowing as you would, if you were talking to sort of your buddies. If we get to sort of that point, I'll say, Michael, I want to broach a particular sort of topic. It's a little bit thorny. And I thought a lot about it, because I so value the incredible work that you have sort of done, and the tremendous sort of like courage, and also sort of trust, what you and I have sort of like built together. And in fact, because of that, I wanted to take a risk to broach kind of a little bit of a thorny, I noticed that just in terms of your check-in and whenever I'm like, how's it going? I don't know if you notice, but you reference women, as the B word and as those goddamn sort of like women. And, I'm mindful like that.
You mean the bitch word?
Yeah, that's right.
Okay.
That word. Yeah. And I wanted to sort of, circle back. I know some of this relates to the very, very painful and legitimately painful experiences you've had, but I have to be very frank. When I hear that, especially as somebody who is sort of woman, it does, I have a particular sort of reaction, so I wonder, if you and I could figure out a way to explore some of your legitimate painful experiences with the women in your life, but in a way that could also feel like this could be a respectful sort of space for the both of us, as you and I are doing the work together. So I just wanted to broach it with you. I'm curious about what you think.
Look, I come here. I'm on time. I show up, I pay the bill. I'm obviously trying to get something.
Uh-oh, I think he's frozen.
No, not frozen. Just
Oh, okay.
waiting.
Oh, I'm sorry. Yeah. I'm sorry. Yeah.
I put some chips on the table.
You're absolutely right. And I so appreciate the level of care and respect and professionalism of you being on time. And in fact, that is the reason why I wanted to bring this up. Yeah.
So I'm going to stop this for now. So you keep going, circling back to try to kind of build that.
I do. Yeah, especially if it's my judgment that my ability to do my work that Michael hired me to do, is being somehow compromised. And Michael, as my patient, might not sort of like know that, if let's say we really speed up, fast forward, and we can't come, and I can't give to Michael what he deserves, which is, a complete sort of attunement without any dysregulation, because he's now getting very colorful, and very provocative sort of the language. I might sort of say, Michael, you deserve, sort of, and it's come to a point where I feel like, this might not be, so we really think
you actually talk about whether you're going to be able to work with the person.
I do.
So, okay. So what if
I might. That's never happened, but I might,
So what if it gets to the point of like more macro, like more demeaning, obscene talk about women or about other ethnic groups or racial groups that what if it gets really nasty? How do it with someone that you have a therapeutic relationship with and it's doing pretty good work, but they might have an explosion of nasty, vitriolic kind of, how do you handle that?
Yeah, I mean, that's a good question. And I'm a firm believer that part of the job of the therapist is to really create sort of the guardrails and the containment, if you will, within that, the sanctity, the sacredness, if you will. And part of that is putting these sort of guardrails and some parameters, So I work with a lot of teens, and sometimes the language can be developmentally very appropriate, but very provocative, and some provocativeness. I'm like, all right, you're just being so 16 right now, and other kind of provocativeness, like maybe somebody using the N word, for instance,
or the C word.
Or sort of any kind of sort of thing, then I do feel like it is my job to notice when the sanctity and the sacredness, and the respectful space that we are trying to cultivate sort of in here is compromised. And then it's my job to sort of say, Jeffrey, in here, I want to sort of talk about it. So I would do it in such a way that doesn't shame my client sort of, but I could absolutely say for here, I know you have told me that all your friends use the N word, and all sort of whatever sort of it might be the case. But in here, for this, between you and I would really appreciate, your restraint from using sort of that word, and with your permission, I'd love to, sort of say, Jeffrey, sort of you said that, and because I do appreciate that this is part of your everyday language, as you have sort of told me, but it makes it very difficult for me because, that word is really loaded on so many sort of levels. I'm happy to talk about it, but you deserve, Jeffrey, out of respect to you and our relationship, and the fact that you deserve my full,
So you do a lot of nurturing that therapeutic alliance. I had a patient a number of years ago, this very prominent guy in the community, and I was doing a couples session, and just briefly, they came in for the first session, and he started abusing his wife emotionally right in the session. And I said, listen, you can't be emotionally abusive in here. It's you can't do it in here. He stood up and he said, doctor, you're a quack. And he walked out the door. And so the operation was a success, but the patient died. I mean, I got him to stop, but she continued in the relationship with him.
He didn't stop. He left giving
So
her the
in that
finger.
situation, I might, maybe take a little bit more time to sort of stretch it out. And then the thing that I keep punctuating and keep coming back to is the relational connection. Without the relational connection,
so how do you build that relationship then?
So part of it, that, Michael, is like, how do we build therapeutic relationship, an alliance? I mean, there's myriad of different variables.
No, but how you do it.
Yeah, but for the purposes of this particular sort of approach, part of it is that the relational connection from jump might feel very compromised if my client or anyone on the receiving end of a difficult conversation, it goes into more self-defense, like protective sort of like mode. It's like shut everything sort of down. So instead of doing it more discreetly and informally, unconsciously, indirectly, I tend to punctuate it and make it very direct and have it verbally. So, out of respect to you, Michael, out of respect to you, Barbara, of our relationship, because I respect our relationship, because sort of you sort of deserve, I keep coming back to that because I might have, if you will, as a therapist, the antidote to the metaphorical poison that you have sort of swallowed. But if there isn't a bridge for us to be able to stand on, you're not going to take it. I do a lot of anxiety and exposure response prevention. I'm asking my patients to do the very thing that scares the crap out of them. Why do they do it? They do it because they trust me. And I do it at a particular time after that trust has been built, And so this in some ways is no different. I keep coming back
to— you're right.
I keep coming back to the bridge, and I keep coming back like, I need to deliver this to my patient Barbara or to my colleague sort of like Jeffrey, but I don't know if this bridge could hold it, so I'm going to have to really fortify it. And every step I take towards meeting Jeffrey on the middle of the bridge, I am building and strengthening and strengthening. And when I do that, because we are social emotional animals, we are wired for connection. And when I be a little bit more vulnerable and more courageous, that automatically activates Jeffrey's brain to also lean into that. Not everybody will.
No, I
but
think
most people
that's
are.
well articulated. Yeah.
I just want to just watching this is fabulous. It's fascinating. And it occurs to me, at this point, it's almost like there are two pathways. One is a person can learn to be, quote, politically correct and learn it's not okay to say bad things about women or Black people, whatever, because I shouldn't. But then the other piece, and I heard when you were saying that to him, it's the idea of developing empathy and mentalization, like to understand, here's a person talking to me, and she's expressing, that she feels uncomfortable, she feels hurt, she feels disrespected. And this wonderful character that Michael's playing, which is nothing like the real Michael, but he doesn't get that piece of it, So I just like your reaction to what I'm saying.
Yeah, I mean, if we think about, if we pause and back up a little bit and really look at this from a bird's eye perspective, whether it is this issue of gender misogyny and sort of sexism or racism, whatever ism we happen to be talking about, we are, being silly or being brave to lean into centuries old sort of like trauma. Yeah. And what trauma is, and what, pain, what is really psychologically, spiritually, physiologically sort of painful, and what leads to are relationship ruptures, they are injuries between people.
That's
Yeah.
right.
If we think about racism, classism, it is the interpersonal, personal, very intimate injuries that we have perpetrated on each other, from very small to very big to system-wide for centuries long.
Yes, multi-generational transmission.
It's so painful,
process,
So it's reasonable then to sort of say, if it's relationship injuries, then we need to use relational connection, in all of its expansive, creative sort of ways, So it's not really about, for me, because, like I'm in my 50s now. So, every woke thing that I could memorize, I'm not able sort of to, so a lot of my students and my high school students are my own teachers, and so we have to sort of really, so it's not about getting all the woke things or all the correct PC, politically correct, but it's having the audacity and the skill to be able to constantly connect, reconnect, even in the face of maybe disconnection, or even after rupture and disconnection.
Yes, you sound very much like Judith Jordan right now. Have you read her work?
Yeah.
Yeah, very much. This is wonderful.
What I would say is that, you see, when you've got someone who has suffered a trauma like this, in a sense, they appreciate you. They're coming back, but they are really afraid. I mean, it's not going to be a quick one.
Yeah, that's right.
So how, and they really need, you might think of it as reparenting by somebody who really cares. And so you're and what I don't understand is, it's not about you. It's about his need to push you away. So, you've made it pretty clear that you get it. It's not so much, you don't have to demonstrate that you don't like the language or it bothers you, but it's kind of silly.
Yeah, and I would,
I mean, what do you do with the silly 6-7-year-old or something?
Yeah, I mean, I would agree with what you said, Michael, and I would only sort of add that it is about my client, my patient, sort of whoever. And it is also about me. I personally don't think about the therapeutic encounter and relationship as a unidirection, but very much of a dynamic, bi-directional, with a lot of reciprocity and mutuality. And we are people with our own amalgamation of subjugated and privileged identity.
Of course.
And so I think that
So where would that come in? Where would some of
where would what come in?
you being, well, I understand what you're saying. I've done some dumbass things and pushed people away, whatever it is that this attack was eliciting. How would you say, I've been, I feel like, I think maybe how you felt, when you felt abandoned, you're kind of like slugging me over the head with this stuff. It's very, very hurtful.
Okay, I just want to make sure I understand you correctly. So what would I say as a therapist? Yeah.
But a self-revealing therapist, you're saying, because it's goes both ways.
Yeah. I mean, I would say, I would go back to what I said in our role play, which is, as a woman, I might, again, as a woman, when you use that particular sort of word or language, it really lands on me in some kind of way too. And it's hard to divorce that. It's not possible sort of to divorce that,
Okay, but what if it's like a racial thing and you're not part of that racial group? Then how do you like, if someone's saying negative things, racial things about a group that you're not part of, how do you, what approach would you take in that? Like, you're making it very personal, as a woman, but what if you're not a Black woman and they're saying negative things about Afro-Americans?
Yeah. And I think that it would actually not be that radically different.
Okay.
Honestly, and I've had many a thing in the consulting room where somebody might use the N-word and they're like, well, you're not a Black person, or somebody might make transphobic, comments, and I don't identify as sort of trans, or it might be some, xenophobic or, anti, Islamophobic, sort of comment, and I might not sort of have that identity, So I would go back to the sanctity of sort of this relationship and the respectful sort of, the thing. And,
that doesn't feel good to you, regardless of, to hear you talk about other people in that demeaning way.
Yeah, I mean, I would do this to first understand where that person is coming from. So, how you said, like, the husband was sort of being verbally abusive. So I went in there. If I were to really use this approach, Jeffrey, I would take my time getting there, especially if I felt like I had the little bit of sort of the time. And I don't mean months and sort of like months, but I would sort of slow down. And that's really sort of the preparation sort of phase. I think we tend to be, and I'm like this, I talk first and think about it later, but this is really a way to be like, what am I trying to do right now? And what are the potential impacts of what I'm trying to do? And how can I optimally sort of do that so that the person on the other end could actually stay on the bridge with me, stay in my office.
Yeah, you need it in your office.
Yeah, that's right. Yeah.
Well, I'd keep coming back.
Yeah. I mean, and I have had many sort of occasions. I mean, this is the beauty of working with young people. And sometimes I've worked with I've had also a long, many years of working with young people on sort of the spectrum. And sometimes sort of the combination of the boldness, no sort of filtering.
Yes.
They'll say, no, you're wrong. You made it worse. I'm like, thank you. That was very helpful. I've had people, not for, DEI sort of related issues, like, you're not helpful, Anastasia, and sort of leave my office only to sort of to come back. Really, I think whenever we can navigate between myself and my clients, some of these difficult dynamics, but then the audacity for both of us to come back and for me to be that sort of anchor, that is where the possibility of reparation and also sort of healing could sort of like, like you got to do all kinds of crap to me. If I was Michael's colleague and he said that, I would be like, get this guy off my team now. Like,
I understand, Jeff. Next week, I'm off the panel. Okay.
but as a therapist, we have a different role. I'm going to go there sort of like with Michael. And next week, I'm going to be here, after we had that weird thing. And what we typically tend to do is when something weird and uncomfortable happens, we default to our knee-jerk reactions, which is what we avoid, we attack. In some sort of a way, we flock with other people. Like my beef is really with Jeffrey, but I am talking to Barbara. I'm like, you won't even imagine what Jeffrey sort of said. And Barbara is like, I could imagine, and then we go at it. But I never go back to be able to repair it with the source, And I think as therapists and using this model, it's an opportunity for us to do something a little bit different. Now, it is not for the faint of heart. It is very difficult. What I tell my students and what I challenge myself, I'm like, oh no, this is really uncomfortable. Then I try to remind myself, if it's uncomfortable, not traumatic, but if it's uncomfortable, then I'm going to bow humbly into that space of discomfort, because that is the beginnings of the possibility of an opportunity for me to grow and heal with myself and with other people.
But it seems to me there are a lot of elements of your personality that make this work in a way that you have a kind of courage. You privilege this in a way that allows you to almost sanctify talking about what's happening in our relationship, and just the language that you're using. I think it's inviting, like lean in, have the courage. These are important connections that can be made. Bridge, and I like the language bridge. We're meeting on this bridge that how you're talking right now just doesn't feel right to me, like the way you're talking about whomever. It's so then the question is, how much of it is you that's what makes it effective, as opposed to can you teach this to other therapists?
Yeah. Well, we all have, thank God we're not robots, and we're not all alike. And with certain encounters, whether it's patients or colleagues, because of our unique temperaments and personalities, it's going to be a better fit than others. That's just the reality. I think it's absolutely learnable and teachable, And the way that I teach and train with non-psychologists, I mean, you are all very sophisticated, so we could tease and deconstruct this in all the psychologically nuanced sort of ways. But when I'm doing, for instance, training with HR in a tech company, they're not psychologists. They're like, what are the three main sort of takeaways? And what I typically highlight, which I have tried to do here, is the relational connection. And we can do it in so many different ways. Who's to say that the way that you and I do the tango is better, Jeffrey, than the way that I tango with Barbara? It's all, or, it is only better and good to the extent that the people who participate, who are sort of in that engagement of the dance, feel good about it. And so I don't know, I really try to keep at the high level as much as I sort of, when things become more complicated and I feel overwhelmed, I try to anchor in the things that are sort of at the more high level, including for me happens to be courage is really sort of like big. For somebody else, it might be something else. It might be patience. It might be compassion. So it's not just sort of conceptually thinking and pivoting towards our values, but it is enactment of our values while we are daring to connect again and again and again, even in the face of sort of like ruptures,
Persistence. Clearly.
I think, I know we are sort of down to the wire. I have two teens at home and I'm just like, it's a very sobering. I'm like, all right, I'm on this roller coaster ride that I'm like, can I get off? I'm like, no, I can't get off because I birthed these children and they're mine forever, but it's like this sort of dance of like, today was great. I'm like, it's great to be a parent. Tomorrow, I'm like, what the hell? I need to go into therapy for sort of support. And, but I feel like in the long run of the relationship relationship is sort of strong if you are like, Barbara, are you and I okay? Where we could weather some small storms and some big ones, and I think that's what we're trying to do with our clients, and not like the absolute absence of rupture. We should create ruptures for the sake of ruptures. But I guess what I'm saying is we shouldn't be afraid of them, because in so many ways, sometimes opportunities for growth, intrapersonally and also interpersonally, happens in those places where things can get sometimes ugly and far from perfect.
So we're going to have to stop.
That
in a
has
minute.
to be oh, Jeffrey, you're going to say the
So
same thing.
But before we end our recorded version, can you let everyone know who is watching and will be watching about the week that you're going to be doing the seminar at the New England the Cape Cod Institute? What week is that?
It is the first week of July and the first week of the offerings through the Cape Cod Institute. So I have the privilege and honor of being part of invited sort of trainers for the Institute, and we'll be there in a sort of residence there for a week long. So for anyone who is interested, would love to be in community with you and roll up our sleeves together and
That sounds wonderful. So everybody come to the Cape.
Thank you.
Well, thank you for such an inspiring discussion.
Quite good.
And we would love to have you back at another time. We'll hopefully get you in the schedule. I know you're probably busy and sought after to talk and present, but thank you so much. So for those of you who are going to hang around, we'll be here for a little while and we will stop the recording now. Thank you all for attending.
There were no Q&As during this hour. I guess